Okay, starting with today's lecture. In today's lecture, we are going to discuss about miasm. In short, what is mean by miasm and the different miasm and what is their main theme. So prior to starting the miasm, in last lecture we studied about Hahnemann's theory of chronic diseases. And in this theory, the Hahnemann put forth the invention of miasms. That is the fundamental cause of disease, miasm. So in this Hahnemann's theory of chronic diseases, Hahnemann, after discovering and practicing homeopathic method of treatment for about 30 years, found that homeopathy failed to bring a real cure in some diseases, in the sense that though the diseases appear to subside for a time under properly selected homeopathic drugs, they always had a tendency to relapse at some future time. In this, that is, the same vital force which is stimulated effectively overcome the infection in acute diseases by homeopathic simillimum remedy fall to the roused effectively against the infection in chronic diseases with the aid of remedies which best cover their present symptoms with regard to treatment of chronic diseases. Hahnemann stated that its start was pleasing, the continuation is less favorable, and the outcome is hopeless. So this is regarding the chronic diseases, that after practicing for a long days, Dr. Hahnemann found that there is something lack in treatment of chronic diseases, that he found that the acute diseases recover completely but the chronic diseases reappear again and again. So what is the reason behind this, that the chronic diseases reappeared again and again? So to study this or to find the solution of this problem, he put forth the different reason to himself, that is what should be the reason that chronic diseases reappeared and again. So he put forth the 5 reasons. In this, first reason was the law of similars might not be the law of universal application. Then second, the number of drugs discovered for use of homeopathic remedies were too few to cover the all varieties of disease condition. Then the third reason put forth, that is, there might be some defect in the application of the law of similars. Then the fourth reason is that there might be some omission in understanding the totality of symptoms which constitute the disease for homeopathic method of treatment. And the fifth reason he put forth, that is, there might be some obstacles overlooked, the persistence and non-eradication of which preventing lasting recovery. So after putting these reasons, he make the study of these reasons, he discussed this and make the arguments, and he found the what is the exact cause of the chronic diseases that reappear again and again. So what we lacking in chronic diseases, so one by one he omitted these reasons. That is, in first reason he diminished the first point on the ground that the validity of the law of similars is based on observation and experiment and supported by inductive and deductive processes, and law was observed to be followed by nature herself to bring about cure of natural diseases. Then the second point he eradicated or omitted by the second reason or excuse never satisfy the founder of homeopathy, as there are number of homeopathic medicines and they are increasing from year to year, and if these medicines cures the acute diseases permanently, then what is the reason behind the chronic diseases? Hence, he could not be the reason. Then, third and fourth reason he omitted by the Hahnemann was led to conclude that though certain cases were temporarily benefited by remedies which seem to correspond accurately with the symptoms actually present, means the law of cure was not at fault, but the defect was in ascertaining the totality of symptoms on wider basis, comprising not only the present syndromes but the past syndromes as well. Then the last reason he put forth as a thus Hahnemann led to think of the existence of some obstacles which after it was once advanced and developed to a certain degree can never be removed by the strength of any robust constitution or can be overcome by the most wholesome diet and order of life, nor will they die out of themselves. And this is the cause behind the chronic diseases that reappear again and again. And these obstacles to cure of many cases was found by Hahnemann after searching investigations and prolonged observations on non-venereal patients to lie very often in a former each eruption, and they and these eruptions of each suppressed by faulty practice faulty practice or one which had disappeared from the skin through other means. And Hahnemann gave general name to this obstacle in the terms of a symptom syndrome. Firstly, he gives name to that obstacle as a symptom syndrome, and later on this obstructive symptom syndrome was named by him as a SORA. And in this way he put forth the theory of chronic diseases and found the new cause of disease, that is the fundamental cause of diseases, that is SORA, psychosis and syphilis, that we call it as a miasms. So this is the part we study in previous lecture. Now in today's lecture we are going to discuss what is mean by miasm and then the types of miasm. So what is mean by miasm? What is your understanding about miasm? So in this the word miasm has some meaning. There are different meanings they put forth according to the term miasm. Then actually what is the miasm in homeopathy, that we are going to discuss. The first, the term miasm has different meaning. In this the term miasm means noxious influence. It is some type of a noxious influence, that we call it as a miasm. Actually word meaning of miasm is, that is the noxious influence. And a miasm is defined as a person's inherited disease group, that is person's inherited disease group. Every human has an inherited miasm and with inherited responses that has been passed down from one generation to the next generation. So it is a noxious influence. Actually miasm means it is a noxious influence, or you may define a miasm as a person's inherited disease group, means in every human organism or a human has an inherited miasm with inherited response that has been passed down from one generation to the next. So there is something, a noxious influence present in every organism or a human being, that is passed from one generation to other generation or a next generation. So it is a inherited noxious influence that is passed from generation to generation, and it was loosely used in his time to express the morphic emanations from organic matter. So in this there are different meanings of miasm, that it is also, it was loosely used in his time, that is what is, it is expressed to express the morphic emanations from organic matter, that is emanations means that is to flow from, that is it is a morphic to flow from the organic matter, and it is passed from some organic matter, animal or vegetable, and sometimes the effluvia, that is an unpleasant and harmful odor that it having, arising from the bodies of those affected by certain diseases. Means this is some type of a disease conditions or a morphic agent that may pass from one generation to the next generation. But Hahnemann has used this in much more precise form and used in the sense of chronic syndrome, that is combination of signs and symptoms associated with a morbid process. So actually the word meaning of miasm is noxious influence, And miasm can be defined, it is a person's inherited power that is passed from one generation to the next generation, or it is an inherited response that passed from one generation to the next generation. And at that time they may think that the miasm, it is expressed as a morphic influence, or that may come from some organic matter, animal or vegetable matters, or that causes the certain type of diseases. But actually Dr. Hahnemann has used this term in much more precise form, and is used in the sense of chronic syndrome, that is, it is a combination of signs and symptoms associated with morbid process. So what it causes, the signs and symptoms which is associated with some morbid process. For this reason he used the term that is miasm. And in this they supposed predispositions to a particular disease, either inherited or acquired, or these are supposed to predisposition to a particular disease condition that may be inherited or that may be acquired disease condition. So this is the word meaning or a uh, definition of miasm in general. But actually what is the miasm in homeopathy? What is mean by miasm in homeopathy? So in this, the definition of miasm which we refer in homeopathy is, miasm refers to the dynamic disease producing power which stains and pollutes the human organism with unhealthy tendency, and thus becomes the producer of different types of diseases. So this is actually the definition of miasm in homeopathy. So what is mean by miasm? It is a dynamic disease producing power which stains and pollutes the human organism with unhealthy tendencies, and thus becomes the producer of different types of diseases. So, what we consider miasm? It is a dynamic disease producing power, means the power which we cannot see with our eyes. It is in dynamic form, and that dynamic disease producing power which causes different types of diseases in a healthy body, and that makes the human organism with unhealthy tendencies. That dynamic disease producing power, we call it as a miasm. So when you have to ask about what is mean by miasm, so you have to explain this main term, that is miasm. It is a dynamic disease producing power which stains and pollutes the human organism. It can stains and pollutes the human organism with unhealthy tendencies, and thus becomes the producer of different types of diseases. And due to these unhealthy tendencies, it causes or it becomes the producer of different types of diseases in healthy human beings. So this is the definition of miasms. Then the miasm may be of two types, that is, they divided the miasm into two types. First one, that is acute miasm, and second one, that is chronic miasm. So it is the classification of miasm, acute miasm and chronic miasm. And miasm, it is a dynamic disease producing power. So in this, the acute miasm and chronic miasm, these are the two types of miasm. So what is mean by acute miasm? So in this, the acute miasm is a dynamic disease producing power which causes acute specific infectious epidemic diseases having almost fixed manifestation. That is, it is a acute miasm which is a dynamic disease producing power which causes the acute specific infectious epidemic diseases having almost fixed manifestation. Means these are the miasm which causes the acute diseases which having a fixed manifestation of that disease condition. And according to Master Kent, and acute miasm is one that comes upon the economy, passes through its regular prodromal period, longer or shorter has its period of progress and period of decline, and which is their tendency to recovery. Means this is like a acute diseases, that is Dr. Kent explain about acute miasm as acute miasm is one that comes upon the economy, passes through its regular prodromal period, longer or shorter period of progress, and period of decline with there is recovery or a death of a person. Then in this, the acute miasm has again of two types. That is, they divided the acute miasm again into two types. That is recurring type of acute miasm and second one that is non-recurring type of acute miasm or also called it as a fixed miasm or a fixed acute miasm. So in this the two types of acute miasms are first one recurring type means those type of acute miasms that recur in the same manner more than once in a lifetime or of a particular person means these are the type of acute miasm in which the disease condition appear or recur in the same manner more than once in a lifetime of a particular person means that this disease condition can be occur more than once in a lifetime of that person, that we call it as a recurring type of acute miasm. And second one that is non-recurring or a fixed acute miasm, in this is also called as a fixed miasm, and these type of acute miasm are those which attack a person only once in a lifetime. As you see that this non-recurring or fixed acute miasm can attack a person only once in his lifetime. That if you are attacked by some disease condition, then you never attacked by this disease condition in lifetime. That is a non-recurring or a fixed acute miasm. So in this they also give the examples of recurring type of acute miasm and non-recurring type of acute miasm. So in this the recurring type of acute miasm contains the dengue fever, chikungunya, swine flu, cholera, plague, etc. These are the recurring type of miasm. Or if once you have a dengue fever, it can come after some time in your lifetime. Then the non-recurring type of or fixed acute miasm is that which attack a person only once in a lifetime, and that may be a smallpox, chickenpox, or whooping cough. These are the examples of non-recurring or fixed acute miasm. That is, if in a lifetime you have a smallpox only once in a lifetime, it cannot recur after the world's episode is completed. So this is the non-recurring or fixed acute miasm. So in this we studied what is mean by miasm, then miasm having two types, acute miasm and chronic miasm, then acute miasm again having the two types, that is recurring and non-recurring or a fixed acute miasm. Then they explain some special type of miasms, that is half spiritual miasm and half acute miasm. Actually these are not exactly the miasm, but they explain these terms as a half spiritual miasm or a half acute miasm, and this can be asked for 2 mark in exam. That is, what is, if you ask that is half spiritual miasm and half acute miasm, these are the special type of miasms, and you have to explain the what is given under this miasms, that is half spiritual miasm and half acute miasm. So in this the first is half spiritual miasm. So in this they explain as in the book Chronic Diseases, Dr. Hahnemann explained miasm of measles, scarlet fever, and smallpox, etc., called as a half spiritual miasm. The miasm of these disease conditions, that is of measles, scarlet fever, and smallpox, etc., called as a half spiritual miasm because of after completing their parasitical existence in the system for some period, they die out, leaving the organism to recover soon if the patient does not die by the time. So, in this, in the book of chronic diseases, Dr. Hahnemann explained about these two types of miasms, that is half spiritual miasm and half acute miasm. So, half spiritual miasm means it is a miasm of measles, scarlet fever, smallpox, etc., that called as a half spiritual miasm because after completing their parasitical existence in the system for some period, they die out, leaving the organism to recover soon if the patient does not die by the time. That is, they having a fixed period of parasitical life. That is, they depend on the human life for that fixed period of time, and after completing their period, they die out, and but within that time the patient does not die by the time. So during that time the patient does not die. So after this, the leaving the organism recover soon, so they don't need any treatment during this period. They die out themselves if the patient not suffered so much. So this is the type of half spiritual miasm. And the peculiar characteristic of half spiritual miasm is that after they have penetrated the viral force in the first moment of contagion, they produce the disease in their own way. Then the parasites quickly grow within it and usually develop a peculiar fever after producing cutaneous eruptions, which in turn is capable of producing its miasm. And finally, they die out, leaving the organism free to recovery. So, when they enter the body, they produce a fever and a cutaneous eruption in that body, which is capable of producing the miasm. That is, that cutaneous eruption and that fever may have a capacity to produce the miasm, means producing the dynamic disease producing power in the future. So finally they die out, leaving the organism free to recovery. And finally they die out, leaving the organism free to recovery, and after the fixed period of time they recover automatically. But in some bodies or in some patient, they may produce the miasm. That is, the dynamic disease producing power may produce in that human being, and in future that human being may suffer from some type of diseases. So this is a half spiritual miasm. It is a special type of miasm that may be related to some disease conditions, that is measles, then scarlet fever, then smallpox, that is smallpox, chickenpox, etc. And they having their parasitical fixed parasitical period in the human organism, and after that they remove by itself. But during that period they produce their disease condition as some fever and cutaneous eruption, and they may have a capacity of producing the miasm that may produce some diseases in the future also. And after the fixed period of time they die out, leaving the organism free to recovery. So this is the half spiritual miasm. Then the second special type is of half acute miasm. If you have to ask about half acute miasm, you have to write about the miasm of hydrophobia. What is mean by hydrophobia? Hydrophobia means that is fear of water. It is the miasm of hydrophobia. It is a special type of miasm that explain about the, that is regarding the dog bite. That is after the dog bite, that is um, dog bite of, that is mad dog. If dog bite of a mad dog, so this is related to the miasm, that is the miasm of hydrophobia. Hydrophobia means that is fear of water. And in this, the miasm takes effect the moment a person gets bitten by a mad dog. The poison of this miasm gets communicated to the nearest nerves. As soon as the malady develops inside the organism, the madness breaks out as acute, quickly fatal disease, and that may lead to the acute, fatal, quick disease that may be caused due to the, that is bitten by a mad dog, and that causes the miasm that we call it as a miasm of hydrophobia or a half acute miasm. So if by chance if you ask in an exam for 2 marks, that is half acute miasm, you have to write that is the miasm hydrophobia has been termed as a half acute miasm. That is, miasm of hydrophobia has been termed as a half acute miasm, and the miasm takes effect the moment a person gets bitten by a mad dog. It is caused due to the bitten by a mad dog. The poison of this miasm gets communicated to the nearest nerves, and as soon as the malady develops inside the organism, the madness breaks out as acute, quickly fatal disease, and that causes a fatal disease in that organism. So these are the two types of special miasm or a special type of miasms, that is half spiritual miasm and half acute miasm. This can be rarely asked for a 2 mark question, otherwise they don't having any importance. This is only explained by Dr. Hahnemann in his book, that is of chronic diseases. So you have to know about this, that is half spiritual miasm and half acute miasm. Then the next type of miasm, that is chronic miasm. Second type of miasm, chronic miasm. So in this, firstly we studied about what is mean by miasm. Secondly, types of miasm, acute miasm and chronic miasm. Then the acute miasm having again two types, recurring type of acute miasm and non-recurring type of acute miasm. Then the two special types of miasm, that is half spiritual miasm and half acute miasm. Then the second type of miasm, that is chronic miasm. So in this, the chronic miasms are fundamental cause of chronic diseases. They produce the chronic diseases and predispose human beings to many diseases. These are three types of chronic miasm. There are three types of chronic miasm, that is psora, psychosis and syphilis. So chronic miasms are the real fundamental cause of diseases, and these having the three types, that is mainly psora, psychosis and syphilis. And then there are again special types of chronic miasm also, that is the tubercular miasm, then cancer miasm. These are again the special types of miasm, but the main three types of miasm, that is psora, psychosis and syphilis. So in this, the chronic miasm go on increasing and growing worse in spite of best mental and corporal regimen and treatment to the end of the human life, and they are in, ineradicable by the vital force alone and without proper medicinal treatment. So to treat the chronic diseases or to treat the chronic miasm, you need the medicinal treatment. Without the medicinal treatment, these chronic miasms cannot recover. The acute miasms have fixed morbid manifestation that can be recovered its own. The acute miasm can be recovered by its own, it having a fixed period, but the chronic miasm don't having any fixed period, and that chronic miasm require a medicinal aid or medicinal treatment to recover. That with the only diet or with the only regimen you cannot treat the chronic miasm. To treat the chronic miasm permanently, you require a medicinal aid or you require a medicine. So this is most important, that is chronic miasms or chronic diseases which are caused due to the chronic miasms require a medicinal treatment, and that treatment may be the that treatment maybe the treatment that cure the that miasm. Means if you have a psoric disease condition, you may require a antipsoric medicine. If you have a psychotic disease condition, you may require a antipsychotic treatment, or if you have a syphilitic disease condition, you may require a antisyphilitic medicine. So in this way, the chronic miasm or the chronic diseases which are caused due to the chronic miasm requires the medicinal treatment. So this is the chronic miasm. Then chronic miasm again divided into the three types, that is fundamental miasms, psora, psychosis and syphilis. So up till now all of you understand about the miasm or any difficulty regarding it? Then we are going to start with a psora. Yes, all of you understand? Actually, word meaning of miasm, then definition of miasm, then types of miasm, acute and chronic, then again types of acute miasm, recurring, non-recurring, then some special types of miasm, that is half spiritual miasm and half acute miasm, and then second type of miasm, that is chronic miasm, it having again three types, that is psora, psychosis and syphilis. Now we are going to start with a psora. So in this, the dictionary meaning of psora, the term psora according to the dictionary means, that is the itch or some similar skin disease or the itch mite. So these are the different meanings of psora word, that is what actually the psora word that having the meaning, that is itch or some similar skin diseases, that we call it as a psora. So the derivation in is Latin and Greek, but it is rather Hebraic in origin, coming through the Greek and the Latin. The original word being, that is sora, T is silent, that is Tsora, that is sora, which means a groove, a fault, a pollution, a stigma, often applied to leprous manifestation and the great plagues. So this is the actually word meaning of sora, that is in dictionary then means sora means it is a itch or some similar skin disease, but actually it is a derivation of Latin and Greek words, and actually the word is sora, that is Tsora. T is silent, that we call it as a sora, and actually the meaning of this word, that is sora, is that it is some type of a groove, or it is some type of a fault, or it is some type of a pollution or stigma. Groove means it is some type of, that we call it as a pokri, or it is some type of a fault or some type of a pollution or a stigma, often applied to a leprous manifestation or a great plagues. These are the relation to some skin diseases. These all words are related to some skin diseases, that is it is a leprous manifestation and a great plagues. Then, that is, the biographer of Hahnemann also remarks that the sora as an impression widely used general term for a whole series of skin troubles. So Can I audible?
Yes, ma'am.
Okay, so we're discussing about the sora. So in this, the meaning of sora, it may be regarding as a groove, a fault, a pollution, or a stigma. And the biographer of Hahnemann also remarks that the sora as an expression widely used general term for a whole series of skin troubles. That is, this is the term that is used for a, that is for the skin troubles, whole series of a skin troubles, that we call it as a sora. So in this, the sora is the most important chronic miasm, which is only the real fundamental cause and producer of innumerable forms of diseases. So what is the sora? Sora is the most important chronic miasm. It is the first and the most important chronic miasm, which is the only real fundamental cause and producer of innumerable forms of diseases. That it can produce a number of diseases or innumerable forms of diseases. And it is the most ancient miasm which has gradually passed in some hundreds of generations through many millions of human organisms and has become the mother of all the thousands of varied diseases. So it is the most ancient type of miasm and it is passed from generation to generation. That is passed some about 100 generations through many millions of human organisms. Means what we know about the miasms, that is miasm, it is a inherited character of human beings, that is it is inherited from generation to generation. So this is the sora which is passed from 100 years back, that is from generation to generation, and had become the mother of all the thousands of varied diseases. So it is the cause of thousands of diseases of that is present in a human organism. So, sora is the most ancient, most universal chronic miasm. So, what is the sora? It is the most ancient and most universal chronic miasm. And during the last centuries, it has become the mother of thousands of incredible non venereal chronic diseases. So, it becomes the mother of thousands of incredible non venereal chronic diseases, and it is the each dyscrasia leading to a functional disorders. So what is mainly it is mainly the each dyscrasia that leads to the functional disorder. So you have to main differentiate between sora and psychosis and syphilis is that the sora, it is a producer of non-venereal chronic diseases. It is a producer of non-venereal chronic diseases. So you must know about what is mean by venereal diseases and what is mean by non-venereal diseases. So non-venereal diseases means that is diseases which are not passed through the sexual contact, that we call it as a non-venereal diseases, and the diseases which are passed through the sexual contact, that we call it as a venereal diseases. So sora is related to the non-venereal diseases, and psychosis and syphilis, these are caused due to the venereal chronic, or that causes the venereal chronic diseases that are through the sexual contact, that is venereal chronic diseases that are related to the psychosis and syphilis. So sora, it is a mother of thousands of incredible non-venereal chronic diseases. This is the main difference between sora and psychosis syphilis. Then there are different manifestation of sora, that is there are stages of sora. It may be a primary manifestation of sora, then comes the latent sora, and then comes the secondary manifestation of sora. Means how you can see the sora, that is all of you know about in all us, that is present the sora, that is miasm sora is present. But how that sora travels, that is what is the primary manifestation of sora. If it is in a primary manifestation, then what comes in a latent sora, and what is mean by secondary manifestation of sora, that is the journey of miasm, that is sora. Up till now we studied about what is mean by sora, what is the word meaning of sora, what are the different terms used for sora, and in this the main theme of sora, that is it is a producer of non-venereal chronic diseases. So after this, now the journey of sora, how it travels from generation to generation, that is what is primary manifestation, then what is latent sora, and what is secondary manifestation, or you may also call it as a different phases of sora. So in this, the primary manifestation of sora, that is the primary manifestation of sora, are the peculiar cutaneous eruptions, sometimes consisting only of few vesicles accompanied by intolerable voluptuous tickling, itching, and a peculiar odor. So when the primary manifestation of sora comes, that is how it look primary, that is, so primary manifestation sora are the peculiar cutaneous eruption. This you have to remember, that is it is a peculiar cutaneous eruption seen on a skin of that human organism, and sometimes consisting only a few vesicles, or sometimes it may be only a few vesicles that seen on a that seen on a skin of that human being. So this is the primary manifestation of sora, and that may be with a tickling, itching, and some peculiar odor. What is the different symptoms you see in a primary manifestation? That is, it is a voluptuous tickling, itching, and a peculiar odor that you seen in a primary manifestation of sora. Then after the primary manifestation of sora, the next stage comes, that is the primary manifestation that may be subside automatically, or that if you take some medicines or some external application, that may subside, and that goes into the next stage, that is the latent sora. That is when the primary manifestation of sora are suppressed by local application, the local cutaneous symptoms disappear, but the disease is driven inwards and may remain dormant in the best cases and under the most favorable external circumstances, and this state is called as a latent state of sora. Means when that manifestation, primary manifestation of sora gets suppressed by some local application. If you use some local application for this skin eruptions in a primary manifestation, they get disappear, but the disease is driven inwards, that is externally you do not see anything. So this state is called as a latent sora, that cannot be seen with eye, so you call it as a latent or a dormant state of sora, that is the disease is driven inside, but externally you do not see anything, and many may remain dormant for some days, and this state you call it as a latent state of sora. And after the latent state of sora, the next stage comes, that is the secondary manifestation of sora. How the secondary manifestation of sora comes, that is when person who has the sora, that is slumbering within, has exposed to some exciting or maintaining cause, the sora which has slumbered awakens and breaks out as the several soric chronic diseases. That is when there is something stimulus happens in that latent sora stage, or there is a when it is in a dormant stage, that's exposed to some exciting or a maintaining cause, that latent stage sora when exposed to some exciting or a maintaining cause, that show the expression as a secondary manifestation of sora in the form of different chronic diseases. That is several type of psoric chronic diseases may be seen as a secondary manifestation of sora. So in this, the development of sora that suppressed by local means that converts into the latent sora, when that exposed to some exciting or maintaining causes, you see the secondary manifestation of sora. So these are the different phases of sora, how the primary sora converts into the secondary manifestation of sora. That is primarily you see only some peculiar cutaneous eruption. When you suppress that peculiar cutaneous eruption with some local application, that goes into the state of latent sora, and when that latent sora is exposed to some exciting or a maintaining cause that converts into the secondary manifestation of psora as a several types of chronic diseases. So this is the secondary manifestation of psora. And when you treat the patient of chronic diseases, you have to treat that psoric influence, which is a dynamic disease producing power that travels from a primary manifestation into the latent psora into the secondary manifestation. And when you treat that properly, at last you will see the peculiar cutaneous eruption in a patient, and when you see that condition, then finally the patient goes in a state of a cure. So these are the different phases of psora, that is primary manifestation, latent psora, and the secondary manifestation. So now the psora having the different symptoms, that it having in a primary manifestation what will be the symptoms, then in a latent psora what is the peculiarity of latent psora, then what is the peculiarity of secondary manifestation of psora, the different symptoms of miasm, that is in psoric patient, what is in psychotic patient, and what is in syphilitic patient. The symptom differentiation you must know, that when you are taking the case of a patient, you may differentiate it is a psoric patient, it is a psychotic patient, or it is a syphilitic patient. So prior to this you know about the theory of miasm, so we are taking this as a miasm. So in this lecture we completed what is the word meaning of miasm, then the definition of miasm, then types of miasm, acute and chronic, then acute miasm having the two types, that is recurring and non-recurring, then special types of miasm, half spiritual miasm and half acute miasm, then the chronic miasm having the fundamental cause of diseases, of chronic diseases, then the there are types of chronic miasms, that is psora, psychosis, and syphilis. And in this we studied about the word meaning of psora, then what is mean by actually psora, and then the different manifestation of psora. Then in next lecture we will see about psychosis and syphilis, and then the symptom differentiation between psora, psychosis, and syphilis. So all of you understand about these things? Okay, and this is also from the theoretical point, from the exam point of view also. That is, if you have to ask any miasm, you have to write these things in a theory. But actually practicing the homeopathy, the understanding of miasm is something different. But actually, this part you have to write in a theory exam. So this is according to the theory exam. But actually, practicing the miasm, in this you have to mainly know about the symptom differentiation, or how the psora develop, how psychosis develop in a patient is different. But this is a theoretical part, and this must be known to you as a student, and this you have to write in an exam also. So this is about the miasm. All of you understand, or any difficulty regarding this? Yes, all of you understand. Why attendance is so less? Yes.